Hey everyone, so it's Q&A Friday. We've got some questions, great questions here. First question comes from Tina and she asks, "Hi Dr. Connie, I read your blog about the importance of movement. I have had a bad flare-up lasting 4 months so far, causing myocarditis. Walking too fast, too much movement, etc. causes pain in heart, tight chest, hard to breathe. Do you think I should be pushing through the pain and move more? Thank you." Hi, Tina. So myocarditis can be quite painful. So I would stay with the gentle stretches and breathing exercises like yoga. That's part of the reason why I promote yoga so much, because if practiced correctly, it has an overall anti-inflammatory effect in the body. Go to our YouTube channel, Dr. Connie Jian, and then you can find many yoga videos under Lupus Healing Yoga. And then you can keep up with some yoga and see what you can do. As you breathe in and out, the myocarditis, and you guys, for those of you who don't know what myocarditis is, it's the inflammation around the heart. So it might cause a lot of bruising-like sensation around the heart, and that would be on the left side of the chest. And so just deep breathing in and out, and that might sort of put the pain under control. So I hope that that helps. Please keep us posted on your status, and thank you for your question. Second question comes from Jessica, and she asks, "I have had frozen shoulder for 1.5 years now. It's in the unfreezing process, and I do my stretches and the range of motion is way better. Do you ever get full range of motion back, and what is the best stretch and exercise to help it faster?" Okay, so yes, we've gotten full range of motion back from our frozen shoulder patients. If you do have physical therapy benefits though, I would highly recommend go to a physical therapist who can manually kind of push the tissues to where you can get full range of motion. That would be the first thing. I personally use a dowel, like have a dowel, like a pole between your hands, and the good arm can raise the arms up overhead. And when you get to a point where you're restricted, you can use the better hand or the good arm to raise it further. So you're essentially leveraging the good shoulder to gain mobility on the bad shoulder. You want to keep pushing to the end range of motion using the opposite shoulder and use your breath to go a little bit deeper, and that will be the best method short of using a physical therapist to help you get there a little faster. So I hope that that helps. Third question comes from Dana, and she asks, "I'm wondering, what is your #1 tip for healing the stomach?" So Dana, our gut is a problem for all of us. Gut permeability is the first thing we should address, and it requires you to eliminate all potentially inflammatory foods from your diet while providing the gut with gut healing supplements. Depending on your budget, we have programs and supplements that you can take to improve your gut issues. We will link the options below if it helps you. Last question comes from Jessica again, and she asks, "I know I ask a lot of questions and I'm so sorry, but what could cause the red blotches and how can I avoid them? I use witch hazel and coconut oil already instead of harsh chemicals and soaps." That's probably a good place to start. I did look at your picture, and Jessica has like a tiny red-like rashes right under the skin. So anytime there is a skin issue, we always suspect gut permeability. While it may feel like they are unrelated, it's more of a systemic problem more than it is a dermatological problem. I would try the elimination diet and refer to the link regarding the gut healing protocols above and supplements to address the gut. And that would be the slow healing guide. Like, it's a process to get things under control. Then the inflammation will decrease and you'll start to have those rashes diminish. As for witch hazel and coconut oil, I don't think that you're hurting it so much, but I would recommend that you look at what you're eating and eliminate the inflammatory foods potentially that you're eating that's potentially perpetuating your issues. I hope that that helped. If you have any further questions, please comment below. Or the new, I guess it's the post that's going to be tagged up at the top with the Q&A for next week will go up. Next week, I'll be traveling and I'll be probably speaking to you from North Carolina. And so if you have questions, please submit your questions there. Have a great weekend.